Well, hello everyone, and welcome to my channel. My name is Dr. Z. I am a clinical psychologist specializing in transgender care. If you're new here, please make sure you do subscribe. And if you are a regular viewer that has not yet subscribed, I would love for you to subscribe. So that way, not only are you helping me grow my audience, but you helping a lot of other people find this content. And if you don't yet follow me on Instagram, a link is below. Please make sure to also follow me on Instagram. I would love to connect with you. That's where I show up daily to share with you tips, guidance, advice, as well as I do Q&As. Yes, I do Q&As on Instagram. So I'd love to connect with all of you on Instagram. Today, what we'll be focusing on and discussing is what physical gender dysphoria might be telling you. It's a big topic, and I am going to break it down into three different manifestations of physical dysphoria. And I will be helping you understand what might those particular manifestations be telling you in regards to your situation. There are a lot of subtypes to gender dysphoria. Physical dysphoria is just one of the most main subtypes. Other subtypes are social dysphoria, sexual dysphoria, linguistic dysphoria. There are a lot of subtypes to gender dysphoria, and I'm going to plan to at least cover the rest of them too in more detailed videos because I know that a lot of you are starving for understanding in regards to your experiences and trying to make sense of what's happening with you and trying to make sense of what any kind of signs of gender dysphoria are telling you. So let's start off by looking in this video specifically on physical gender dysphoria. For starters, what is physical gender dysphoria? Physical gender dysphoria is when you're experiencing a distress, when you're experiencing a discomfort in regards specifically to physical attributes of your body. Specifically, if we were to really break it down even further, it's about you feeling any sense of discomfort, any sense of disalignment with primary and secondary sex characteristics that tend to stereotypically communicate to the world binary view of gender. The discomfort, which we call gender dysphoria, can and does range drastically from individual to individual. It can range from feeling completely neutral to feeling mild discomfort to feeling severe discomfort. Those I'd say that's actually a range of level of intensity to gender dysphoria. And today I will be breaking it down based on this range because each range within this particular subtype also may have clues, may have insights in regards to what it is trying to tell you and how much, if anything, it has to do with gender identity. Those of you who are regular on this channel, who've seen a lot of my videos, already know and familiar with my own conceptualization that gender dysphoria stems from multitude of root causes. Some of you may have one initial root cause, but chances are there are multitude of root causes that tend to overlap and tend to lead to individual feeling gender dysphoria. If you're also familiar with me, you also know that I ascribe to a belief based on my experience in the field that experiencing gender dysphoria doesn't automatically mean a person is transgender. People may experience gender dysphoria for a multitude of reasons, and we're going to be discussing one of them here today. So, without confusing you, right, I don't want to overwhelm you, let's break it down into three groups. Group number one of individuals who experience physical gender dysphoria. Again, think about physical discomfort with your body, with either primary or secondary sex characteristics or combination of the two or both. Individuals in this first category, and this is the severity in terms of intensity, the first category is going to be the most intense. What do I mean by most intense? A lot of times when we say individual feeling intense sense of dysphoria, people think to the old dogmatic narrative of, oh, you must really, really hate your body. You must really, really hate your genitals. You probably want to get rid of your genitals. You probably want to maybe even mutilate your body in order not to feel distress. That's a very, very severe. Today, people may feel the severity to that extent, but seldom do they express it in the same way. Nonetheless, the first category of intensity of physical dysphoria is where you are feeling quite a bit of discomfort. How do you know you're feeling quite a bit of discomfort? Anytime you think about your physical attributes, anytime you may look and see your physical attributes, or anytime anybody comments or mentions anything in regard to your physical attributes, if you feel very alienated from it, if you feel as if it doesn't belong to you, if you feel a sense of disalignment, if you also feel a strong sense of discomfort, a strong sense of distress, strong sense of tension within yourself, anytime you think about those secondary and primary sex characteristics, I would put it more on a severe end of intensity. Individuals who feel this intense about their physical characteristics tend to then fall into multitude of categories. I know it sounds overwhelming. Multitude of categories of why you may feel that way. So in other words, a multitude of root causes. But I'm going to cover the two main ones, and these are the two main ones that I bet is something that a lot of you think about, that concerns a lot of you. The first one is the root cause is gender identity issue, meaning the reason why you feel such strong intensity towards your secondary and primary sex characteristics and such intensity to experiencing physical dysphoria, physical distress, is because the gender assigned to you is not the one you resonate with. Therefore, that means you're leaning on the side of identifying as transgender, using transgender as a big umbrella term with all of the other identity underneath, but any identity other than the one that you were assigned at birth. So that's the first category. For individuals who experience physical dysphoria from childhood or later in adulthood, it becomes really easy to pinpoint that the root cause is gender identity because it is always tied to gender. It is so secondary, primary characteristics that give you that level of distress are all tied, anchored to gender identity, all tied, anchored to gender assigned at birth that you're not comfortable with. This is when I do assessment for individuals to find out if they do in fact have gender dysphoria stemming from gender identity as a root cause. This is one of the things that I look for. On the other hand, we also have individuals who had quite severe experiences of sexual trauma. And as I said in my other video, sexual trauma will affect, for some individuals, their relationship with their primary and secondary sex characteristics because sexual trauma has to do with violation of one's body. When a violation of one's body appears, individual is going to feel a distress in regard to particular body characteristics. We know this for a fact. We know that, for example, women who had severe sexual abuse may have challenges with intimacy, may have even have symptoms such as vaginismus, just to name a few. So we know that for a fact the body will shut down, the body will respond to trauma, and an individual will develop a discomfort with particular body parts depending on sexual trauma, the severity of it, how long it went on, and what associations you made post-trauma to those body parts. So for that reason, the root cause also might be sexual trauma if you are feeling a strong physical gender dysphoria in regards to secondary or primary sex characteristics. Now, how do you distinguish the two? Because that's the key element that a lot of people tend to ask me all of the time. How do I know it is trauma that needs to be worked on because it's a root cause, or how do I know it's my gender identity as a root cause, and therefore I may need to step into some kind of transition elements? The simplest way that I can describe to you, if you are thinking about trying to figure out which one is which, first, for starters, obviously, do you have history of sexual trauma? If you don't have any history of sexual trauma, then you're ruling this out. That means that physical gender dysphorias that you are experiencing that are on a scale of intensity that severe and giving you that much discomfort with your secondary primary sex characteristics, high chance are, I'm not going to say 100%, but a very high probability stems from gender identity as a root issue. Now, if you are asking yourself and you do have history of sexual trauma and you don't know where is this stemming from, where gender dysphoria is exactly stemming from, my history of sexual trauma, or is it stemming from gender identity root issue? Other way to look at it at that point is this. Whatever you feel strong sense of distress about, let's say you're feeling a strong sense of distress in regards to genitalia. Ask yourself then, am I feeling this distress because of a gender that they communicate to me? And when I take it further, I'm feeling distressed because the gender that they communicate to me is the gender I don't resonate with. You see where I'm going with this? Root identity issue. Versus, am I feeling discomfort with my genitalia because when I think about my genitalia and how uncomfortable I feel about it, trauma comes up. Those bad memories come up. The violations of my body comes up. I don't like my genitals because the boundary was crossed and people took advantage of me in a sexual way that was inappropriate and was wrong. Root issue, sexual trauma. This is the simplest way. Sometimes it becomes more complicated and the two overlap. People can and do have root issue of gender identity, and also it so happen that they also sustained and have history of sexual trauma. This is where, a good clinician can become really, really handy in helping one differentiate. But this is the simplest way to kind of look at the two, right? So that's the group number one. Group number one, you're experiencing physical dysphoria and it is quite intense in intensity. It could be telling you two of the things. One, that the root issue is gender identity. Two, that the root issue, if you do have this, is severity of sexual trauma. Group number two. Group number two is you experiencing physical gender dysphoria, but you describe it as a very mild discomfort. A narrative may sound like this. I feel uncomfortable with my gender assigned at birth, and there's certain things about my physicality that I want to change. And this is a common one, by the way. But my genitals don't really give me much distress. I don't like them. I don't think they belong there. But I don't really have severe dysphoria, so I'm probably not going to do anything about it. That's a very, very common one. The common thing about this narrative is that you are recognizing that there's a body part you're not comfortable with, and you further than acknowledging that while you're not comfortable with it and you would rather it was not there, the level of discomfort is very mild. Versus group one, remember, it was quite intense. So the second group is where it is kind of like a mild discomfort. You just feel like, it's really not that big of a deal. And you may feel about that in regards to other physical characteristics. It could be your breasts, your chest, it could be your shoulders, it could be your hips, it could be any other aspects of your physical self. If you're in a group two and you're experiencing this like mildish discomfort and you're still wondering, could I be trans if I have such mild discomfort? What I'm going to clarify for you is why you may experience mild discomfort versus to a more intense discomfort. It's not that everybody needs to have intense discomfort, but it's that by far and large, in my experience, for a lot of individual adults, especially if they've been struggling with dysphoria for a long time, they then sip into what I call dormancy or latency effect, meaning the severity is there, but you're not aware of it yet. you're not yet, I would say, fully in touch with it. A lot of times, people start getting more in touch with the severity of it when they step into some kind of transition elements. For example, it is incredibly common. Oh my goodness, I can't tell you how common this one is, where individuals who identify as trans feminine tell me that I feel neutral, fine about my genitals. I don't really hate them. I don't really love them. So I'm not going to have bottom surgery. Totally valid, right? Not everybody needs to have bottom surgery. And then for a lot of people, what happens, what I observe happening is this. They stepped into gender affirming care. And as their body starts to shift and as their body starts to take on the physicalities that is closely aligned with who they are, and especially as they start stepping into any other kind of gender affirming surgeries, for example, top surgery, chest surgery, what I see for individuals is that suddenly, once they see their body gets more aligned, then the genitals are become like this screaming, blinking light that now starts to feel incredibly in disalignment with the rest of the body. And part of this is dormancy effect. Part of it is what I say is the dysphoria is there, but you're just not really waking up to it yet, right? The latency. Part of it is you lived so long with the bodies that you don't feel comfortable with that you became kind of numb to this body. Especially a lot of you are going to be experiencing a lot of dissociation and depersonalization. And as a result of living for so long with this, you become detached from it. You also become conditioned looking at yourself in the mirror all of the time in this body that doesn't belong to you. So you kind of develop, for some of you, you develop over time this type of neutrality to your body. It's not until you start doing something and your body starts to change and evolve, and you start witnessing it evolving into who you really see yourself being. So then you start suddenly seeing how all the things that you became numb to, all the things that you became just kind of uh, whatever to, suddenly you're starting to feel about it. It's the same thing about perspective, right? A lot of you don't know how severe your dysphoria actually is until you start doing something about it. It's not until you start feeling better that you're able to look back and understand how bad the pain was. To contrast to the pain has to be the opposite of pain. It has to be joy. It has to be happiness. It has to be feeling free, feeling aligned, feeling as your authentic self, euphoria. So once you start feeling euphoria, only then do you realize how much dysphoria you actually had. So this is a very common one in group 2. So if you're in a group 2 and your physical gender dysphoria is mild, you feel you can acknowledge you're not comfortable with this body part, but at the same time, you're not feeling severity. It could be that you are in this dormancy state. And it could absolutely be for you that as you go down and become more and more aligned with who you are, that can shift from mild to quite severe gender dysphoria. I see this all of the time. Or it could continue to maintain mild and you may not do anything in terms of seeking gender affirming surgery for that particular body part. Also very, very common. But I just want to be clear about that because sometimes people say, well, I read somewhere on the internet that I need to have severe genital dysphoria, and if I don't have it, I'm not transgender, so I'm just not going to do anything about my gender identity, all the while feeling the discomfort, but it's there. Just because you're not yet feeling and sensing it doesn't mean that it's not there. The third group of individuals, now we're going down on that intensity level. We started with very intense group to mild group. Now we're getting to the group that has a narrative that sounds like this. I feel neutral about my gender assigned physical characteristics. And when I ask, what do you mean by neutral? People often say that it's not that I hate my body. I don't also love my body. I'm just neutral. My body is there. That's all it is. It's just there. And I think some of you can resonate with it. And this description of physical gender dysphoria as a neutral state, as like neutrality, can oftentimes throw a lot of clinicians off the track. And it throws a lot of clinicians off the track because then clinicians thinking, well, if you're feeling neutral, then you don't have to do anything about it, right? Without probing and asking more questions. And yet, if you are presenting or if you are feeling neutral about your physical physical self, right? Because we're talking about physical dysphoria here, physical self. But yet, while you're feeling neutral, you're also realizing that you're not resonating with your gender assigned. That's also a very telling sign. Because the truth is, there's a lot of people who just feel neutral about their bodies, right? And they don't have gender dysphoria. There's a lot of cis people who feel neutral about their bodies. There's a lot of people of all different gender identities that feel neutral about their body. It doesn't often mean anything. It becomes to mean something when in the midst of this neutrality, you also feel like the gender that you were assigned is at the same time is not your comfortable position, is not something that you're comfortable with. And the narrative then may sound like this. I just feel like uh, I connect and I feel like internally I am a woman or a man or a non-binary person. But my body I feel neutral about. But internally, I just know that the genders that I was assigned is just not comfortable for me. I never resonated with it. I never identified with it. It never felt like it belonged to me. So do you see how it's important to also have a particular also senses of internal experiences on top of also experiencing and assessing physical dysphoria? What does it mean if individuals feel completely neutral, yet at the same time don't feel comfortable with their gender assigned at birth? Oftentimes, I see this happening with individuals who have a long history of repression and denial. What is repression and denial? Repression is when you unconsciously repress thoughts, memories, ideas, feelings that you don't feel comfortable with. You basically, it's almost like your brain says, this is so uncomfortable for me. We're going to go ahead and put it in this room within ourselves and lock the door and never open the door. And once it's outside out of mind, a person can stay in a state of repression for decades. This is why so many of you have gender crisis in your middle ages, really gender crisis in the middle 40s, 50s, even 60s, when you suddenly wake up and you have this big, huge realization, big, huge gender upheaval. The reason why you have it is because the repression door has swung open. So, repression. Denial, on the other hand, is much more conscious. You are aware something is going on, but you're telling yourself, I'm not going to go there. You're willingly closing the door, but you know you're aware of what's behind the door. Again, repression is the unconsciously the door has been closed, and you're not even aware of what's behind the door for a long time. Denial is you're aware, but you are making a choice to close the door. Both denial and repression are psychological defense mechanisms there to protect you, to protect your psyche, because you feel like questioning and going and confronting all of these feelings you feel are a threat to you. What I see is this: the longer a person has been struggling either with denial or repression, the more they're going to have a narrative of, I don't feel comfortable with my gender assigned at birth, but I also feel very neutral about my body. And the reason why there's going to be a narrative of feeling neutral and why there's going to be an absence of feeling physical dysphoria, this is what throws clinician off, is that how can you say you're not comfortable, but you're not expressing any physical dysphoria? If you're not comfortable with your gender assigned at birth, then you should feel this discomfort, severe ideally discomfort, with your physicality, but people feel neutral. And the reason why they feel neutral is, again, because the longer things have been repressed, the longer you've been staying in this position of complete detachment from your relationship to your body, complete detachment from relationship to secondary and primary sex characteristics that are tied and related to perceptions of gender. I see this again and again and again. And it becomes really difficult for individuals when they start to wake up from denial, from depression, and start to feel the things. It can be an overwhelming feeling, but at first it's a feeling of neutrality because you're not in touch with those things. Imagine those feelings of distress that most likely for a lot of you have been there from early years, had been locked behind the door for decades. Of course, you're going to lose touch with them. Of course, you're not going to even know what they feel like. So that's the third one. If you're feeling neutral, But you also have a narrative of I'm neutral, but at the same time, I'm not comfortable with my gender assigned. That it could be is there suppression and denial that are at play, that are stifling, that are keeping those feelings at bay. It doesn't mean that they're not there. It's just that you're not aware of them, again, because they've been locked away behind the door for so long. The key question here to ask yourself is it possible that something has been repressed? Is it possible that I've been in denial? And one way to look at it is to really go back in a childhood memory lane, to really start to stirring up those memories within yourself of your childhood. Was there a time of period about gender bending experiences? Oftentimes when people start thinking about it, they start realizing that, wait a second, I remember when I was a little kid, I remember I was gender bending, and I remember it was very rarely, but I remember doing it, and I remember my parents not being comfortable with it. Well, guess what? One look, one glance, one sign of disapproval, disgust, shame, verbal or nonverbal from a parent is going to be enough to repress, to close the door for a long period of time for a child who's eager, who's trying to seek parental love, approval, and acceptance. A child is going to do anything to seek proximity to their primary caregiver. And so it's going to be enough to repress it. It's harder to repress stuff when we're adults because we have different intellectual capabilities at our disposal. But when we're kids, all we're seeing is this link. It's almost like we're still perceiving umbilical cord between ourselves and our mom, and metaphorical umbilical cord between ourselves and our father. And we're constantly seeking that approval and validation. So these are the three most common elements of physical dysphoria and what they could be telling you about yourself. First one, again, you're feeling quite intense physical dysphoria, and it could be telling that the root issue is gender identity. If you do have sexual history of trauma, also it could be that the root issue is sexual trauma, and you should really look at it closely. The second category is feeling mild discomfort, not feeling severe. This could be a dormancy latency effect at play. And the third category is when you're feeling neutral, but at the same time not comfortable with your gender assigned at birth, but yet you're feeling neutrality about your physical body, physical characteristics. This could be due to denial and repression. Hopefully this is very helpful. I have a lot of individuals who come to me and they are sticking because all of you read so much. I'm sorry, there's so much crap on internet. A lot of you read a lot of internet where you come across the things that says you have to feel this way, you have to not like especially your genitals, you must not like especially your secondary primary sex characteristics, and if you feel okay about it, you're definitely not transgender. And that's a very narrow, very reductionistic way of looking at such complexity as gender dysphoria. Remember, no two people experience gender dysphoria the same way. Gender dysphoria is a psychological distress stemming from some kind of discomfort with gender assigned at birth. That's the foundation of it. Then, once we start dressing up that foundation with your contextual history, with your, for example, once I start dressing up foundation of gender dysphoria with somebody's history of decades of repression and denial versus somebody's history of no repression or denial and feeling the dysphoria constantly for decades and being very aware of it, well, now we're looking at two very distinct manifestations of gender dysphoria, and each one tells you a different story. So comment below, let me know when it comes to physical gender dysphoria, which one do you experience the most? Is yours more intense? Is yours more mild? Is more neutral? You also, all of them can and do overlap, meaning, I'm sorry, I'm not laughing at the gender dysphoria, but I'm laughing because it is so wildly complex. This gender dysphoria is this is why I'm so against clinicians using reductionistic approach, because there's so much to it. There's so much understanding goes into it. And again, like I said, it does overlap, meaning you can feel severe intensity towards one body part or characteristics, then you can feel neutral about something else, and then you can feel mild about something else. Again, all of those things can overlap. It's not black and white. Oh my goodness, it's so wildly not black and white. It's it is part of why I love this work so much, because I'm a dork and I'm a geek and I love figuring stuff out, and it gives me such complexity to constantly roam around it. But my God, I also understand how incredibly difficult it makes it all for all of you, because it is such a mind fuck. And I can only imagine how difficult it is for all of you to make sense of how you yourself experiencing gender dysphoria and what is it trying to tell you. So comment below, let me know if you how you feel about when it comes to physical gender dysphoria. And I'll also make sure to do a video on social and sexual. Those are the two really, really big ones to further lend you some more clarity. Comment below, let me know, and I will see you all next time. Bye.